US Health Secretary Alex Azar has accused China of resisting information sharing and failing to warn the world on the COVID-19 pandemic. Speaking on a visit to Taiwan, he said this had led to increasing costs for the rest of the world. It isn't a new allegation from the United States and some other countries. But inside China, too, stories are emerging of people who've paid the price for the alleged lack of transparency. Zhang Hai, a resident of Shenzhen, is angry with the government for not making public details about the virus, which he claims could have prevented the death of his father in Wuhan. Here's more.
The small neighborhood park near his home in Shenzhen is a place filled with memories for Zhang Hai.
Last year, my father used to sit at this place. Every time I come to these familiar places, places I used to visit with my father, I'm overwhelmed with grief. At the same time, I feel anger.
Zhang Lifa, Zhang Hai's father, was a veteran of China's nuclear testing program. He was a Wuhan resident, but he spent his last years at his son's home in the coastal city of Shenzhen, about 1,000 kilometers from Wuhan. In January, he broke his leg. As a veteran, he enjoyed good medical insurance, but he was required to get treated in his hometown, Wuhan.
When he needed treatment, I took him to Wuhan, and when he was in hospital, I sat by his bed. This was my way to show my love for him. We Chinese don't like to talk about our feelings, to express our love with words, but we show them with deeds. Now I feel haunted by remorse. I feel that by taking him to Wuhan, I sent him to his death.
At that time, COVID-19 was already spreading in the city, but local officials were reassuring people that the virus could not be transmitted from person to person. A lie, as it later turned out. His father contracted the virus in hospital. Zhang Hai could do nothing but to sit by his bed and watch him get weaker and weaker. He has kept videos of his father's final days on his phone. Zhang Lifa struggled for 1 week before he died. His body was immediately taken for cremation.
In my opinion, the officials who covered up the disease in its early days have behaved like criminals.
China has since largely managed to control the spread of the virus. Life is back to normal in most places. The government prides itself on its ability to contain new outbreaks through testing and quarantine. The public mood has shifted from anger to appreciation of the government's response, and those who want to remember the sufferings of the past are under pressure to keep quiet. Zhang Hai has tried to file a case in court against the authorities. His case was rejected. His social media accounts were shut down. He has received threats from the authorities.
These events have left us relatives of the victims with a boundless feeling of pain. It's a pain that will stay for the rest of our lives. But the local authorities just say, this matter is already over. Their tone shows a complete disregard of other people's lives.
All that's left of his father's life are pictures of happier days. Zhang has not even retrieved his ashes from the crematorium. For fear of public outbreaks of anger, the government requires that victims have to be buried in the presence of officials, a condition he refused.
That report by correspondent Matthias Berlinger. In the Philippines, President Rodrigo Duterte has volunteered to be the first in his country to try a claimed new COVID-19 vaccine developed by Russia. Duterte suggested that Russia wanted to offer the vaccine for free to the Philippines. There has been no confirmation from Russia on this, but a senior official said clinical trials were expected to begin in the Philippines soon. Here's more of what Duterte said.
Sabihin ko rin kay President Putin, I will tell President Putin that I have huge trust in your studies in combating COVID-19.
Your studies in combating COVID, and I believe that the vaccine that you have produced is really good for humanity.
To show my trust in them, I will tell doctors that I will be the first to get vaccinated when the vaccine arrives. We will see if it works. If it works on me, then it is good for everyone.
For more, let's go across to my colleague DW correspondent Ana Santos, who joins me now from Manila. Ana, good to see you. I'm wondering how Filipinos view Rodrigo Duterte's offer to try out the claimed Russian COVID vaccine on himself.
Well, that statement has gotten a lot of mixed reactions. There are a group of people who are saying that it's absolutely preposterous to volunteer himself. And at the same time, there's another group that just says, you know what, sir, if you want to be the first one to try out a vaccine that has not, according to global health authorities, has not gone under mass clinical trials, then be our guest. You can be the first one in line for that. We have to remember that the Philippines is still suffering from its traumatic experience with vaccines because of the botched dengue vaccine program from a few years back. That's where a lot of this is coming from. So this lack of confidence in vaccines in general, plus this overconfidence in an overpromise of a Russian vaccine, has caused incredulous sarcasm among the public and just a lot of skepticism as well.
And of course, Anna, this offer from the president is coming in addition to a resurgence in cases in the country. And this has already pushed the capital, Manila, into another lockdown, something you are experiencing yourself. How is that going?
Well, we're in the middle of the first week of lockdown, and we have yet to see a drop in the new COVID infections. This lockdown was called for by the medical community, who issued out a distress call saying that if we do not do this, the health system can collapse. So you can imagine the kind of state of emergency that call from the medical community had spurred. Now, emotionally, if I could just go into that, what people are telling me is that they're very emotionally and economically hurting. We had 3 months of lockdown before this starting March. So a lot of people feel that those valuable 3 months of one of the longest and most punitive and strict lockdowns could have been used to prepare the health system so that we could have avoided this kind of mismanaged approach to COVID-19. Additionally, a lot of people are just so very emotionally distraught. Just today, if I may share, there was a friend who had to deal with the death of a parent and a husband who she had lost in a span of 1 week, both due to COVID. The cases are hitting very close to home. And underneath all of this economic suffering and this emotional pain is a lot of, I should say, simmering of anger now. People are calling for 3 things: the resignation of the health secretary, a complete revamp of the COVID task force, which is mostly comprised of retired generals, and replace them with scientists and epidemiologists. And mostly they are demanding for a concrete health-driven plan. And they're telling the president that waiting for a vaccine, no matter where it falls or comes from, is not a plan.
Tough times for us all. Ana Santos in Manila, thank you so much, and please stay safe. It's not just the Philippines, but Vietnam as well, which is fighting a resurgence in coronavirus cases after more than 3 months without any domestic transmission. The latest outbreak began in the central city of Danang and then spread to more than 13 locations around the country. Authorities have moved quickly to contain the latest outbreak.
Planning for the worst, Vietnam has converted this sports arena into a backup COVID hospital. Should the outbreak worsen, the 1,000 beds here would ease the pressure on hospitals in Vietnam's coronavirus epicenter, the city of Da Nang. There, on July 25th, Vietnam confirmed its first domestic coronavirus case in 3 months. 2 more infections were reported the next day. The government wasted no time in responding. It banned wildlife imports, reimposed social distancing, suspended the domestic football league. And on the 27th, all tourists were ordered to leave Da Nang. 80,000 people, mostly Vietnamese holidaymakers, were abruptly evacuated from the beach resort. Authorities were taking no chances, and people were not protesting. I should go back tomorrow afternoon, but I'd rather fly back tonight. This is a situation no one wants, so even though it's not convenient, we totally understand. I just want to return to Hanoi. Danang emptied fast, a shock for Vietnam, which earlier won international praise for being a pandemic success story. No domestic cases in months, thanks to quickly imposed travel bans, lockdowns, quarantines, and widespread tracing and testing. Suddenly, those achievements seemed in danger. All provinces are at high risk and should raise their alert level. Senior officials there and the whole political system should take action. The public should be careful and alert and follow instructions. The virus has since spread past Danang with over 400 additional cases and at least 16 deaths. Compared to most countries, those numbers remain minuscule. The government hopes the tactics that proved themselves in the past will again do the trick. But this latest outbreak shows how quickly the virus can re-emerge when people think that it's been beaten.